So I'd like to introduce geneticists Dr. Nadia Falah and Dr. Audrey Woerner to help us explore ways in which telegenetics can be efficiently used to reduce barriers to accessing genetic services. Dr. Falah is an assistant professor at the Department of Pediatrics, Division of Genetics and Metabolism at West Virginia University. She's one of the West Virginia Advisory Council on Rare Disease and a board-certified medical geneticist and a member of the American College of Medical Genetics and Genomics. Dr. Falah's work has been published in peer-reviewed journals, and she has presented at medical conferences. Dr. Woerner has been providing telegenetic services for over 10 years. She's the director of telegenetics at UPMC Children's Hospital of Pittsburgh and provides both inpatient and outpatient telegenetics consult services. I had the pleasure of meeting both of our speakers as they utilized NIMAC's telegenetics training in past years. They have both become leaders in telegenetics in the region, and NIMAC has been able to provide some funding to support their telegenetics efforts in recent years. So welcome to you both.
Thank you.
Thank you very much. It's a pleasure to be here. Thank you all for coming, and thank you, NIMAC, for allowing us to speak today. So let's get started. Optimizing your telegenetics visit. So we do not have any conflicts to disclose. Our learning objectives today, or we'll start with defining some terms that are commonly used in telegenetics and describe some general benefits and limitations of telegenetics. We will summarize patient and provider telegenetics visit preparation tips, provide some strategies for optimizing the encounter, identify a few examination techniques that will allow for improved interactive physical examinations, and list remote testing strategies for overcoming barriers to remote genetic testing. We're going to start with some audience participation so that we can get to know you a little bit better. This is the Mentimeter system that has been used in previous lectures and presentations. There's a link in the chat, or you can go to menti.com on your phone and type in the code 88947656. So our first question is, what have you liked about the conference so far? Small groups, range of speakers and topics, being able to hear from providers and GCs, formative, family experiences, definitely, information, great speakers and topics. Wonderful. Interaction. Focus on broader access for patients, definitely. Wide range of presenters. Great. Well, thank you very much. We'll move on to the next question. So which of the following describes you best? Genetics provider, patient or family member, student, administrator, or other? Looks like we have a lot of providers here, some students, patients and family members. Some answers in the chat for those who don't have access to Mentimeter. Some more providers. Great. Well, hopefully we'll be able to give you some additional tips. I imagine that most people are experts in telemedicine by now. So our next question is, how frequent is your participation in telemedicine or telegenetics visits? Would you say never, a few times, once or twice a month, weekly, daily? so a lot of telemedicine in this group. Daily and weekly are our highest. A few who have not had any telemedicine or telegenetics. Great. Okay. So what word, for those of you who have had any experience with telemedicine or telegenetics, what single word would you use to describe your experience? Precarious. Perfect. Convenient. Stressful. Sure. Frustrating. Surprising. Evolving. Effective. Convenient is definitely our number one right here. Unpredictable, for sure. Getting better, so that's good. Hit or miss, for sure. All right, thank you. That is very helpful. Awkward, yeah. Great. Thank you for your participation. Did you participate in telemedicine or telegenetics prior to the COVID-19 pandemic? Yes, a lot. Never or rarely, or yes, a few times. Looks like about around a little more than half, never or rarely. A few people participated in telemedicine a lot before the pandemic, and a few, yes, but not often. Great. Well, thank you. This is very helpful information for us. So I think we're going to get started. We're going to start with some terms that are commonly used in telegenetics and telemedicine. So we'll start with telemedicine. The definition of telemedicine is use of telecommunications and information technologies for clinical services. That is opposed to telehealth, which is a broader term for the use of technology in healthcare. Telehealth can include telemedicine, as well as electronic medical records, distance education for teaching and continuing education. Telegenetics is specifically providing medical genetic services utilizing telecommunications and information technology. The originating site is the location of the patient. It can also be called a spoke site, patient site, remote site, or rural site. This can be a medical facility where the patient travels to a medical facility, or it can be the patient's home. And certainly with the pandemic, the patient's home has become a more frequent originating site. The distant site is the location of the health professional providing the consultation. It's also called a hub site, a specialty site, or a referral site. A telepresenter is a person who is often a nurse or medical assistant who's located at the originating site, so the place where the patient is, to assist with the telegenetics visit, particularly when the originating site is a medical facility. However, if the originating site is the patient's home, a family member can act as a telepresenter. When we talk about peripherals or peripheral devices, we're talking about digital stethoscopes, examination cameras, ophthalmoscopes, and other devices that can be connected to a telemedicine cart or device at the originating site where the patient is to allow a physician to simulate an in-person examination. And that's going to be a theme throughout this talk, is simulating an in-person examination via telemedicine. So just a few more terms. Synchronous is occurring in real time. So audio video conference, like we're in today, is a synchronous activity. Chats, instant messaging, application sharing, and whiteboarding are all synchronous activities. Asynchronous is when data are transmitted and then evaluated, but not necessarily in real time. Examples include shared workspaces, databases, email, previously recorded audio or video, shared calendars, webbooks, discussion boards, and blogs. A medical example of asynchronous activity is when, say, a person gets a chest X-ray done early in the day, and then later in the day, the radiologist reviews it and generates a report. So there are many, many telemedicine devices. Here are some of the most common devices. It's important to remember that the default setting on many devices is not encrypted, and software, different types of software is used in telemedicine that could be used in telemedicine are not HIPAA compliant. So that's something to keep in mind when you're choosing a device and or a software application. So these are all pretty common devices. So we have our tablet here, laptop, desktop, phone, cell phone. So all of these have audio and video capability. And of course, if all else fails, the good old telephone. Some additional devices that are typically used in a medical facility setting. Of course, there's the desktop, which could also be in a telemedicine suite at a hospital. But there's a telemedicine cart. There are a lot of different types of carts. They're basically a computer on wheels for the most part with a camera. And then many of them have the ability to plug a peripheral device, such as this digital stethoscope or this digital camera, into the cart to again simulate an in-person visit. So some benefits of telegenetics. It's an efficient mechanism to utilize the limited number of genetics professionals. There's just not that many of us. So we need to find ways to be able to spread the love, if you will. It allows provision of genetic services to underserved rural and urban areas, and allows provision of genetic services during a global pandemic. The licensing and originating site restrictions on telemedicine have been relaxed during the COVID-19 pandemic. Previously, the provider had to be licensed in the state where the provider was located, as well as the state where the patient is located. That has been relaxed during the pandemic. And then many insurance companies, almost all insurance companies, and depending upon your payer system, would not pay for the telemedicine service if the originating site for the telegenetics visit was in the patient's home. And that has been relaxed during this pandemic. So as a result of the relaxation of these rules, there's definitely been an increase in the use of telemedicine services, and that includes telegenetics. Some additional benefits: decreased travel time and associated cost for patients, decreased time lost for work for parents and patients. And then if inpatient telegenetics consultations are provided, this can often allow patients to remain hospitalized in their local hospital and not require transfer to a tertiary or quaternary care center. So I'm going to hand the baton over to Dr. Falah. I'm going to stop sharing my screen, let her take over.
That looks good. You are muted, Nadia, by the way.
All right, I think I just All right, can you see my screen?
Yes, yeah, we can.
Okay, sorry about that. All right, sorry everybody. This is Nadia Falah. I'm one of the clinical geneticists, WVU Medicine. So thank you for giving us this opportunity to talk about our experience using telegenetic service. And I want to first describe the telegenetic networks that we were introduced to, and we had many resources utilized through their service. As you know, we have the RGNs, the NYMAC, the NCC, and they all do provide training to genetic professionals as well as to patients. They have a video content and online content. They focus on billing, reimbursement, equipment, and regulations to enhance access to telegenetic service and implementation in the region. So we utilize their service as was early mentioned by Alyssa. We use it, we are here today in this meeting. We participated in an online as well as an in-person training, and also we had some financial support from them. Now, the telegenetic assessment have a very similar component to the in-person visit, but there are some limitations, and I wouldn't call them limitation, maybe there are challenges that through training and education, those challenges could be overcome. And many patients have expressed throughout my experience the concern to perform or to elect to do a video visit versus coming to the in-person visit, especially if the patients have an interest to perform genetic testing. Many of our patients are not aware that genetic testing can be done remotely, and all of the component of the visit can be addressed through the telegenetic service. So we always emphasize to our staff when we offer them the option to do either video visit or an in-person visit, to give them an information about that testing can also be completed, and the component of the visit can be completed through the throughout the appointment using the telegenetics. All right, so one of my challenges using the telegenetic service is the worry to unable to connect with my patients due to technical issues. And I wonder what's your challenges. I know that there was a question at the beginning, but I want you to share here in the chat section that one thing that you have a challenge, especially if you have used telegenetic in the past. All right, so technical difficulties using the interpreter, that's a very good point. Patient driving, I wonder if he is driving and using the telegenetic service. So physical exam, missing some elements, that's true, and we will talk about that in detail in the next slides. Not using secure Wi-Fi. As we mentioned in the past or earlier, Dr. Woerner mentioned about the HIPAA and using the devices that are more appropriate for telegenetic. Unsure if I was signed in correctly. Appointment started. Parents do not know how to adjust camera screen. They're all an interesting challenges. So hopefully that we will address some of the tips to overcome those challenges in the next slides. All right, so we first going to give some advice to our patients and for those who may experience using telegenetic in the future. So there are simple tips that could be applied to make telegenetic service very similar to an in-person visit. For example, the preclinic communication is very important, preclinic preparation. Please do not underestimate the importance of reading all the providers' material that can be sent to you, as well as fill out any questionnaires that are sent complete all of those and send them back to a provider before the evaluation can be completed. You may also receive a call from a clinic personnel to address the visit components, as what we do with our patients, to describe all of the elements and some expectations throughout the visit. So the goal is to make the visit is very close to an in-person's visit as much as possible. One of our important things that a patient can learn is to take vital signs of their children or for themselves, especially that if they have high blood pressure, if they're concerned about fever, what they can do, they can purchase a very simple equipment through a common pharmacy, Walmart, CVS, and they use the digital display material or equipment that are very easy to use, and they can provide those readings and measures to their doctors either during the visit, or they can do it even before the visit. We found those are very helpful and very useful, especially if the patient is educated and be able to do them, educated before the visit by a telegenetic training or a telemedicine training in general. So those equipments could be very handy and could be like even oximeter could be important to be available in every house these days. Now, if the provider asks you to take pictures, make sure that you take a very clear picture, front and back. For the face, you can do the profile view left and right. Make sure to add the hands, the feet, and also if you have a concern about a skin finding, for example, bruises, hypopigmentation, or hyperpigmentation, take a very clear pictures of those locations as well. Provide them with your provider or provide them to your doctor before the clinic. Those could be very helpful. Now, during the time of the appointment, please sit erect and try to be in the middle of the screen, similar to my situation right now, and also as it's shown in the slides here. If you have an infant or a child that is for the evaluation, make sure that you put them in their lap and facing the camera. The provider can look for their behavior. They can look for as well as facial features, especially if there is developmental delay, behavioral issues that are part of the concern. We recommend that you do not hold the device. You don't have to have the phone. It's very important that you have an eye contact with the camera, as well as to have a free hands to be utilized for any maneuvers that the providers ask you to do. It is not required to have an embedded camera in the device, but it is recommended because it may give you a good eye contact with the provider in a similar way that you are in the clinic. Be in a private room, as well as make sure that the light is good and no background distractions. Dress professionally with light clothes that you can access extremities if needed, or to show the neck. Avoid any hats or hoodies or things that may cover tight clothes that may not be able to access for examination if needed. And also communicate clearly and report any disconnection or voice breaking up. Ask questions as needed and express concerns as appropriate. And then after the visit, the provider, if they recommend doing genetic testing, there are options of doing genetic testing. They could be through the blood, or could be through the saliva testing. Pick the choice that will work for you. And we will talk about saliva testing in the next slides, but there are options of doing genetic testing, especially if you don't have a lab close by or a local community hospital. So saliva testing could be an option here. And it's actually utilized very often with telegenetics and in the clinics as well. Now, for follow-ups, if the doctors recommends follow-ups, make sure that you either you call and make sure that you know the date of the follow-up and to confirm that that will be scheduled for you. Now, Take notes as appropriate. I would suggest that you ask it questions. If the provider gives you a differential diagnosis or a possible diagnosis and you don't know the spelling, ask for the spelling. Also ask for explanation. As appropriate. I think that we sometimes give a medical terminologies and patients are not very kind of aware of those. So if there is anything that we misstated in medical terminology, ask questions throughout the visit. Make sure that your device has a good a speaker as well as a microphone. An internet connection is a key here. Very important that you have a high-speed internet that is connected to allow for a better communication and a clear communication, I would say. Now, if the provider, as you can see in the last part of the slide, if the testing is the next step, ask about, look for in the mail how the provider recommended the test. Are they going to send you a kit in the mail, or are they sending you to the closest location of a lab or a community hospital to perform those testing? Make sure that you have a clear understanding of the next steps to make it easier for you to have an effective visit with all of the components completed. So telegenetics, it's not a FaceTime with your friends. It's recommended that you be in a private place. So we don't recommend that you have the visit while you are driving or while you're doing a grocery shopping, or having lunch, or having dinner with friends. I don't think that dinner could be, but lunch or breakfast. So very important that you mimic what is done in the clinic in terms of professionalism and being in a private room. Provider may ask you to do some maneuvers as part of the physical exam, so you need to be ready for that, as well as provider will share some very sensitive information. So being in a private room with all the securities regarding the internet connection are very crucial here to make you comfortable, as well as to make the provider continue with the visit clearly without any limitations. Now, remote testing is an important component for the telemedicine or telegenetic. As I mentioned earlier, if the provider recommends genetic testing, look at the mails, make sure that you follow up to see if there is any a kit in the mail. Usually those kits will have instructions about what you have to do. Saliva spits are very commonly used with telegenetics, and we do have some failures in completing the test. But what we recommend is that you make all of the steps and follow all of the instructions that are available in the kit in terms of spitting at least 30 minutes before you spit. You shouldn't be eating or drinking. If you feel dry, you don't have to drink water and then spit at the same time. So make sure that you give a high quality saliva, and that to ensure that it has a DNA. Write your name, write your date of birth, all of the identifiable information, your identifiable information on the tube, to make sure that the lab will know that that sample belongs to you. Now, also seal the tube very well to make sure that there is no leaking in the tube. There will be a shipping bag inside the kit. You put it in the shipping box, you put it in a shipping bag and take it to the closest postal office to have the test completed. Now, a lot of patients ask me, is blood similar to saliva? Or what do we prefer? Is it, can we do the saliva testing? Do you prefer the blood? So most labs now rely upon saliva collection, and they can also use a swab for infants and children who cannot spit. You can also use oral rinses. And there are multiple studies that have shown that the saliva DNA has a high quality in very equal to a blood testing. We know that the amount of the DNA is less, but the quality is what defines that the saliva testing could be an equal to the DNA testing. Now, is saliva testing only have the leukocytes, or does the saliva testing have DNA just from the buccal area or buccal region, or does it also come from the blood? We believe that, or not we believe, we have confirmed that the saliva testing has both leukocytes as well as a buccal cells that can be utilized or used for DNA extractions. And a lot of children like saliva testing or buccal swab over blood testing. However, we have a lot of adults that will prefer doing a blood. Some patients feel a little bit nauseated by spitting a lot on the tube. So we give the patient the options of what they have or what they want to do in terms of testing. All right, so this is an example of a scenario that I would say about telegenetic visit. We have NZ is a 19-year-old woman who was seen initially via a video visit for her history of melanoma. Family history was positive for pancreatic cancer in two third-degree relatives. Genetic testing was recommended due to a concern of pancreatic cancer melanoma syndrome. Genetic counseling was provided and testing was completed. For her follow-up appointment, NZ requested a video visit as she lives more than 2 hours away from the clinic. Testing did not identify pancreatic cancer melanoma syndrome, but did show that NZ is a carrier for cystic fibrosis. NZ was counseled about the finding and was informed about the risk associated with the pathogenic variant in the CF gene, as well as the reproductive risk for CF. NZ's mother called the clinic and reported that NZ developed anxiety after the visit and was concerned about the risk for her future children and about CF particularly. So NZ scheduled a follow-up in person, and she was counseled in-person visit. All right, please share your thoughts in the chat section about this case example. Okay, any thoughts about this particular case where she is a 19-year-old and she has a history of melanoma? We have a concern about melanoma pancreatic cancer syndrome. We saw her in the clinic, we saw her through a telegenetic, and after that she was recommended testing. We sent her a kit to her home. Testing resulted with a carrier for CF. Now, usually panels for pancreatic cancer will include the CF genes, as there are some preliminary findings suggesting that CF gene or carriers have an increased risk for pancreatic cancer. And we counseled her. Her main concern was not actually a pancreatic cancer, but her main concern was more about her future children, and she went into an anxiety and panic attack. A mother called at the office, and then we scheduled her a follow-up appointment in person to discuss this further and to give her more explanation. So do you say that this is a failure in the genetic test, telegenetic service? Do you think that this could be a positive result even for maybe like CF? We as a provider consider that it's not a major finding, but for patients, other patients could be. Do you think that positive results should be disclosed in person? In the chat section, if you can comment about that. Does not require physical, so it's good for telegenetic, but positive results. That's the question about positive result. Patient who might have an anxiety, maybe having a history of panic attack, how we should and I want not just the provider to give me their comments, but also patients. If you have an anxiety and the provider is disclosing a positive result through telegenetics, what do you think? Do you think that you can handle that? Do you think that an in-person visit should be? Do you think that telegenetics is not appropriate for a positive results regardless of how severe it is? Okay, so we have Dr. Nurmachi here. If possible, we prefer to do a cancer result in person. Also have a friend or family member present at the result visits. Yeah, that's a very important to do. And this is what I would say take home message from this visit throughout our experience here, our team in general, that telegenetic is convenient methods to access genetic service to those who reside or live in rural areas. As you can see here, that the patient wanted to do telegenetic service. Even she could have come to the clinic, but and patient prefer to be seen in their home. However, some patients will need an in-person visit based on their past medical history, especially if it's young and have a history of anxiety, panic attack. So positive results, as Dr. Nurmachi stated, that they better to do them in person, even if the patient lives a few hours away. It's still could be problematic for some. Now, and the last thing, it is observed in our practice that an in-person visit may be needed even after the telegenetic visit. I wouldn't call it failure, but I would say an incomplete assessment could be done through telegenetics. So you start as a preliminary and then you bring them to the clinic for a full evaluation. And again, some cases will require initial visit in general. We have Lubna here say, do you think your patient could have been counseled about her results and the anxiety by telegenetic? Yeah, that's a good point as well. I don't think that her medical history with anxiety was in the chart, and I don't know if she had reported a panic attack when we asked her questions. But it's important, I think, that before we disclose the results, to look into that if they have past history of anxiety or panic attack could be addressed before we move on with disclosing the results. All right, so sharing experience with the provider, and I will let Dr. Woerner share her own experience, and she has more than 10 years of experience with telegenetics.
Thank you. Nadia, could you advance the slide for me, please?
Okay.
So we'll switch gears and speak about physician challenges with telemedicine. While genetics professionals can definitely interview, observe, and counsel patients via telegenetics, the amount of information that can be conveyed to providers via telemedicine is limited, as we can see from the experience of several people in the chat. Nonverbal cues can be missed. The physical examination performed remotely remains a challenge. And then a poor internet connection or technical difficulties can quickly derail a telegenetics visit. So again, mirroring an in-person visit. So all the same things with a few additional to account for telemedicine. Of course, professionalism, device and positioning is important. So we want to make sure that the family can see the physician, that the physician is in a well-lit, physician or genetic counselor is in a well-lit and private room. Of course, internet connection is crucial. And then if a pre-clinic questionnaire has been provided, reviewing that in advance of the visit, just like you would in an in-person visit, is helpful. Visual aids and diagrams can be used if indicated. These can be shared via screen share or via email prior to the visit so that the patient can follow along. Photos can be obtained from the patient prior to the clinic visit or even after the clinic visit. Demonstrate aspects of the physical examination to the patient that they don't quite understand. For example, if a patient is not familiar with the Baton scale of hypermobility, you can demonstrate those maneuvers to the patient to help them go through that. If the originating site, again, where the patient is located, is at a medical facility with a telepresenter, this can be quite helpful as the telepresenter can document vital signs, assist with the examination, utilize telemedicine peripherals such as digital stethoscopes, exam camera, and ophthalmoscopes, and they can troubleshoot technical difficulties in real time. We have several ways of providing telegenetics services at our facility. I provide telegenetics outpatient consults in the Erie and Johnstown areas at an originating site that is a medical facility. So there's a telepresenter. Using the grant from NIMAC, we actually purchased some exam cameras and stethoscopes to make the exam much more similar to an in-person visit. We also provide telegenetics consults with patients in their homes. And it can be more challenging, especially if the internet connection is not great. The picture can be fuzzy. It can be difficult to get a good skin exam. So we reserve some of those. If someone has to be seen via telemedicine and isn't interested or lives too far away to be seen in person, we try to, if the physical exam, getting a really good physical exam is more important for the indication for the visit, we try to do those at a medical facility as the originating site versus the originating site being in the patient's home, or a combination of both in more than one visit. So of course, just like an in-person visit, frontal and profile views of the face can help identify important physical features, and some genetic disorders can be diagnosed via facial gestalt. Additional important physical examination findings, again, can be identified in photos provided either before or after the visit, or live video examination. A family member, if the patient is at home, a family member can act as a telepresenter and help focus the camera on the appropriate body part for examination. So some difficult areas. A skin exam can be difficult via telemedicine, especially for someone who's referred for hypopigmented or hyperpigmented spots. When you're doing a thorough skin exam, it's very important to have a private room because you have to look at all of the skin. If access to a telemedicine exam camera, such as can be used in a medical facility, is not available, either an inpatient visit may be required or some very detailed photos. Again, the Baton scale for evaluation of generalized joint hypermobility can be limited, though many aspects of this examination can still be performed via telemedicine. You can't feel the skin to see how soft it is, but you can have the patient pull their skin up to see if it's elastic, and you can do most of the Baton scale via telemedicine. The one exception is measurements with a goniometer. It's difficult via telemedicine. Reviewing records can also be helpful when you are unable to do the physical exam yourself. For example, reviewing echocardiogram results for a patient who was referred for evaluation due to congenital heart disease. Nadia, you're muted.
All right, so I will be talking about the follow-up visits during the telegenetic. Usually follow-up evaluation are easier, but that also depends if the initial visit was an in-person or if it was also a telegenetic visit. Established patient, we do not require hands-on physical examination for most of them. Patient history, review of the system, and reconciliations of medication can be easily completed via telemedicine compared to the new patient visit. Reviewing the genetic result and counseling is very similar way to be completed in an in-person visit, but just pay more attention for those positive results. Positive results, again, that might be better to bring them to the clinic. provider or provide the patient with follow-up recommendation, also complete instructions about if testing is recommended or if they need to have a follow-up appointment. So that could be also completed before the end of the visit. Right, I have another case example where a AT was seen via telegenetic for evaluation of autism spectrum disorder. The visit included history, physical exam, genetic counseling, recommendation of remote testing, but test was never completed. All right, if you have experienced this in the past, please share your thoughts in the chat section about this case example and what are barriers that may have prevented testing from being completed in this patient or in similar patients. I'll be looking at the chat section for your thoughts about this because testing is an important component of genetic testing or the telegenetic visit in general. So if the patient is counseled, consented, insurance authorizes the test, but the test kit remains in the garage or in the mailbox for days and the patient doesn't complete it, maybe because of a little bit of a stress completing it or postponing. And we have a lot of patients we have one patient, actually, she came to do it in the clinic after we sent her the saliva kit to her home, although that was easy to be completed here. So I have here not different from clinic visits. Some patients never go to the lab. That's true. That's very true. The test kit could have gotten lost in the mail. Well, some of them, they actually confirmed that they received it, but they did not complete the test. Contact patient to learn why. Yeah, that's a very good, important point. Follow-ups, lack of access to drop-off box, to a mailbox. That's a very important point, especially that I'm practicing in West Virginia, and there are some places that the mailboxes or the postal office is a few hours away from the patient and completing the test, and then they want to take it to the postal office. Interestingly, that recently, Invita has placed an option for you to choose which postal office that can be used to drop off the saliva kit. They have the UPS as well as the FedEx. So depending on the location of the patient, how far is the postal office from their home that can be used. Lack of access, you have an issue with the instructions in the kit only being available in English. That's correct. I think that we may want to request the test to be, the instructions in the kit to be in multiple languages, or at least to the preferred language by the patient. There should be another option when we click on sending the kit, which language is preferred for the genetic file with the kit. All right, so our common reasons, I know that all the reasons that you share are very valid and they are very true. So a sample is not provided by the patient. In many occasions, sample failure due to a patient may provide the sample, but they may not put their information in there. There could also be a leak in the kit, and that happened on many occasions as well. Mailing address could be a little bit far again, or the postal office could be a little bit far, and the patient does not have a drive to drop off the mailing box. We have many patients in West Virginia who their mailing address is a PO box, and most of the labs, they do not ship to a PO box. So the lab has to ship the kit to a relative of the patient, and then the patient had to communicate with the relative, and it makes a lot of delays and a lot of deficiency in completing the test on time at some times. All right, so please follow up with a phone call if the sample is not received. Provide a comprehensive and pre-test counseling. Patient education plays an important role here. Genetic associate could help mailing the replacement test kit and convey that to the patient. So we always have to be in touch with the patient and follow up with all of those deficiencies if they happen after the telegenetic visit. KJ was seen via telegenetics to review results. Genetic testing identified a variance of uncertain significance. The provider explains the result, provided genetic counseling, and KJ expressed understanding. The following day, KJ sent a message via an online portal with questions about results. As she reported that the video conversation broke up and she was unable to hear the full conversation at the time of the visit. So counseling was completed, patient voice understanding, but then the second day, there was a message, well, I didn't hear you well. Can you please explain it in a message? Now, what's your thoughts? Do you think that you have similar experience that the patient voiced understanding and then they went into discussion or questions in through a phone or through an online chat portal? That's very good. Provider can check in occasionally to make sure patient can hear, see, and is following conversation. That's correct. Although some patients will say, yeah, I don't have any questions. Yeah, it's very clear. But then they will say after that, they probably want the visit to be completed in some situations and they want it to be done. And after that, they will come up with questions or they actually could not hear us very well. By ensuring the patient knows, they should let the provider know if at any point that can see or hear. That's very true. Instructions to the patients by the provider, by the genetic associate could help eliminate such a challenge. All right, so some common reasons, again, the internet connection, as I stated, is a key. We are not able to interpret nonverbal cues via telemedicine as we can do with the virtual or the in-person visit. Miscommunication or questions may not be realized until after the visit, and background noises or lack of a private room could also increase the chance of having this issue. All right, overcoming telegenetic failure. A good internet connection is a key. Report any miscommunication, ask questions appropriately, and attend training, conferences, and meetings like this one. So here's the summary. Careful preparation in advance of the visit can significantly enhance the quality of your telegenetic experience for both patient and provider. So this is not just a doctor's responsibility, but it's all responsibility, patient and provider, as well as the genetic team. Recognizing the limitation of telegenetic and adjusting accordingly goes a long way towards having a successful visit. Ensure a well-lit private area of the visit. Medical facility, office, or home is essential for a positive telegenetic experience. Telegenetics has broadened access to the genetic service and decreased the cost, travel time for patients, and can replace an in-person visits, but certainly not in all indications. I will be happy to take any questions.
Thank you so much. If anybody has questions for Dr. Falah or Dr. Woerner, please go ahead and put them in the chat. We have about a minute, but we can get to a question or two.
see one question in there from Sarah Kane.
So Sarah Kane's question is, can you comment on the role of the telepresenter? Is this someone who is hired specifically for this role or a care coordinator / nurse / MA at the clinic? So assuming that the telepresenter is in a medical facility, our telepresenters are the nurses who staff the clinic already. They're specifically trained. Once a telegenetics clinic is opened up at that location, they receive specific training from our telemedicine team on how to use the cart, how to use the peripherals, how best to interact and help the patients interact via telemedicine.
Yeah, I can say we've seen a very large variety of who is used as a telepresenter in clinical sites. It really can be almost anybody that's on staff, or there definitely are times when they bring someone in new. If they're starting a new telehealth service, they'll bring in a new telehealth coordinator / telepresenter. So it's sort of all over the map, but I think there's training available to support whatever staff gets put into that position.
So there's another question here. What % of my visits are telegenetics? About 25% of my clinic visits are telegenetics, I would say. Most of those are outpatient. I get occasional inpatient consultations from some of the originating sites in Erie or Johnstown, mostly Erie, but most of those are outpatient.
Okay, well, thank you so much to Drs. Falah and Woerner for sharing their incredible experiences with telehealth and strategies to optimize the experience for patients and providers. I think most of us see a lot of telehealth and telegenetics in our future, so this will be very helpful. We're going to head back to the main session now. You'll see the links in the chat come up to take you back to the main room, and we're going to hear about continuous quality improvement for our afternoon session. When you go over there, we will be announcing a break now, but if you head over there and they'll tell us about the next gift card giveaway.